This is a decision that was taken by the GHA COVID gold structure yesterday, following their meeting, following consideration of the bed occupancy in the hospital, in particular bed occupancy in the COVID CCU, which is at 100% with 13 patients, and also the bed occupancy in Victoria Ward, which is our positive COVID ward, which has 25 patients occupying beds. Now that, in combination with the number of staff who are not able to be at work because they are either positive with COVID or in isolation as a result of COVID, then the clinical management of the GHA, who met yesterday, felt that it was necessary to escalate the posture to black in order to have the hospital in a state of alert and more particularly in a state of preparedness should the number of COVID cases increase in the hospital or increase in the community.
Now, in the Lewis Stagnetto Rehabilitation Department has been redesigned. What is its specific function?
At the moment, it was being used for occupational therapy and for physiotherapy. Now, the equipment that was available there has been stored for the moment, and what we have done is that we have brought 40 beds from the Nightingale Hospital at Europa Point, and we have established a St. Bernard's Nightingale ward on the ground floor of St. Bernard's Hospital. Now, this is to be able, it's another step to have the hospital ready for an expected influx of COVID patients, and the patients who will be in this new St. Bernard's Hospital Nightingale facility, which is a smaller facility than the one that we have available at Europa Point, will be a low acuity ward. The kind of patients who are going to be there will be patients who are in the hospital who are clinically discharged but continue in hospital, therefore they need a low level of medical care, or patients who may have been positive in the Victoria COVID ward and are unable to be discharged home, but they are feeling better. So initially the intention at the moment is that this new ward will be a low acuity ward, and the reason that it's been established in St. Bernard's Hospital is so that the hospital can better and easier cohort staff within the same building.
You mentioned there's something very important, that the hospital is gearing up, preparing for any new surges we might have in the community. In your statement today, you do say the transmission in the community remains uncontrolled. Controlled, a strong term, a term which might cause a bit of alarm in the community, especially seeing the hospital prepping up and gearing up and stepping up. What do you mean by uncontrolled?
We've seen that the number of positive cases in the last couple of days are lower. But when it comes to predicting hospital admissions from COVID, these are based on positive cases from a week or 10 days ago. So the medical advice and the advice that the clinicians have based their decision on is the basis of the positive cases that we've had in the last week and the last 10 days. As you know, that was when we reached our highest peak of positive cases, and it's expected that people who were positive and have not recovered will now shortly commence being admitted to hospital, and that it's on the basis of those predictions that these measures have been taken. And that is why it is so imperative that people follow the rules. We've now been in lockdown for over a week, but the results of the lockdown, and the lockdown, if you recall, was a 2-week lockdown and intended to work as a fire break, but we've not yet seen the results of the lockdown because the results will now start manifesting. What we're dealing with now is the number of positive cases that arose before the lockdown.